Welcome back, listeners, to another episode of Susan Lopresti Wellness, Mind, Body, and Soul. This is the podcast where we explore the highs, the lows, and everything in between when it comes to a woman's life, her health, and all aspects of navigating the midlife landscape. I'm your host, Susan Lopresti, and today I have a very special guest with me. Her name is Dr. Anju Mathur, and she is a functional medicine doctor. For over 15 years now, she's been a leading holistic and functional medicine practitioner that has been administering prescriptions that infuse her patients with long-term health and also blue zone tempered wellness that defy the effects of aging. To customize diagnosis, Dr. Anju and her staff at Angel Longevity Medical Center hone a creative combination of resources that boost the immune system and promote prolonged renewal at the cellular level. Dr. Anju prescribed health plans typically include a combination of natural medications, bioidentical hormone replacement therapy, IV treatments, fitness, and nutrition coaching. As a menopause specialist, she has successfully guided hundreds of women through midlife changes with her attentive treatment methods. She has trained and practiced as a medical doctor in the greater Los Angeles area. She is board certified in anti-aging medicine by the American Academy of Anti-Aging and Regenerative Medicine. She studied at Maulana Azad Medical College in New Delhi, followed by a residency at Martin Luther King Hospital in Los Angeles. She trained in functional medicine at IFM, which is the Institute of Functional Medicine. And without further ado, welcome, Dr. Anju, to my podcast. I'm so excited to have you here.
I do functional medicine. I do bioidentical hormone replacement therapy. I think we should talk about bioidentical hormones because we want to give them what they want, what they need. In other words, what would make sense to them. I think the bioidentical hormone replacement will be a good topic so they can understand that that's pretty life changing.
Yes.
Once you do that.
When I was reading some information about you, it said that you began to go through some health challenges, and that's when you turned towards functional medicine more so. So I wanted to have you talk about your own personal experience as well, because I have my own personal experience of why I chose to go to a functional medicine doctor. And actually, I read Suzanne Summers' book. I think it was Ageless, one of her books that she wrote. And she talked about this doctor in New York City. And I was having all kinds of crazy symptoms, migraine headaches out of nowhere. My whole body was aches and pains. I gained a lot of weight. And I would just go to, regular doctors telling me, oh, it's perfectly normal for a woman your age to be feeling like this. And it'll pass. And one of the doctors, I even said, well, do you want to check my hormones to see like where I'm at? Am I deficient in some, or do I have too much of one? And he says, oh, at your age, your hormones are all over the place and it's erratic. And one day they could be in one area and then a couple of weeks later it could drop. And I was like, this just doesn't make sense. And I'm not a doctor, but I know it didn't make sense. And when I went to a functional medicine doctor and everything started to improve, that's one of the reasons for my podcast is I was thinking, what would have happened to me if I just accepted what they said? And just said, okay, this is my future. This is the way I'm going to be living for the rest of my life. But I kept looking at my mom, who was 25 years older than me. And I don't ever recall her going through anything like that. So I wanted to get your story, why you went towards functional medicine. And so I think that would be like a very compelling story. And I'm sure a lot of listeners would relate to it because we all go through it.
Oh, 100%. I think majority of my patients come with the exact same scene as you just described, that they go and they see their primary care doctors and they beg them to even check their hormones.
Yeah.
And they get refused. And it even has gone to the point where I think one of the patients mentioned the words. I mean, I was like really surprised, but they said, oh, just this is just something you have to just go through
Yeah.
and just suck it up.
Basically, that's what I was told. And I couldn't accept that.
I know. So I'm really happy that you're doing this because I think women deserve to know better. They need to know what the options are. They need to know we, at this age and era, we have the opportunity, which our mothers and our grandmothers did not have.
Right.
They did not have. As I can see my own mom, by the time I got into this kind of medicine, she was already in her 80s. And so at that time, you're kind of used to whatever lifestyle you have and you
Yeah.
don't see anything better coming out of it. So she didn't really appreciate that, and there is actually a funny story about my mom. And that helped me grow as a doctor, as a physician, treating different kinds of people. And so one day, my mom was like walking really slow. And I said, hey, would you want some more energy? Because I can do something about that for you. And her answer was, Anju, what do I need the energy for? And I said, you know, it's true. What does she need the energy for? She's not going to go out in the gym and start, exercising. I mean, she's got everything she needs. She's, comfortable. So this is why that gave me a perspective of how to treat a person to what they need and they want.
Yeah.
So this is why we do personalized medicine. Like we want to do exactly what you want to have happen for you. So not everybody's the same. Everybody has their own lifestyle. They're expected to do certain things. Some people are not. So I don't want to go beyond the point where they say, you know what, I'm doing great. So it's not really any kind of rote procedure. It's more like what that person needs, and we do that most efficiently as possible. So we're not wasting time or money or energy, and we just accomplish what that person needs.
Right. Exactly. And we're all individuals. So it's not a one size fits all for every patient that walks through your door. And, that's the way I was being treated. Like, oh, well, all women. No, I'm not all women. Me. And I
Exactly.
never had migraine headaches before. So why am I getting them all of a sudden? Why does my gut look like I'm 6 months pregnant? Why did I gain 35 pounds when I'm not eating any differently than I ever was before? I have Hashimoto's disease and I have celiac disease. None of those doctors ever even considered. One of them knew that my thyroid was underactive, and he did put me on Synthroid, but we didn't go further. He didn't say it was an autoimmune disease. He didn't talk about diet and lifestyle changes with me. He just handed me a prescription. Take this on an empty stomach every morning and you'll feel better. And it was way bigger than that.
That's right. I mean, honestly, if you have to know, we medical doctors get training in nutrition of about an hour.
I heard that.
So that's the training. So that obviously, I remember my mom asking me every time she would fall sick or something, she would ask me, Anju, what should I eat? And at that time, I had no idea about nutrition. So I would just say, you know what? I don't really care. You can eat anything you want. And that was my standard answer every time she would ask me. And I'm Indian. So, Indians are very, we have a tradition of Ayurveda for
Yes.
5,000 years. So it's very natural holistic approach, and there is all the spices, the things that herbs that you get in nature.
Yeah.
So she would always be using those, and she would be asking, "Hey, what should I eat?" I'm like, "I don't care." And so, but now it's obviously I've learned a lot about nutrition. I've educated myself, and in my own time, and understood what is really going on in terms of overall health. And it has nothing to do with drugs or lack of drugs. So the drugs are not the reason. I get so many people that are put on antidepressants
Yeah.
or anti-anxiety drugs because of menopause,
Yes.
which is so sad because this is why I say, it's not the lack of Ativan that's making you have anxiety. It's not that. So it's not that you need this thing because you're lacking it. It's a synthetic drug. Has not got any part of your biology. And so we take them off, gradually we balance their hormones out, and then we take them off of the drugs. So that would be my final product of what I do with the person, is to make sure everything is natural. They're balanced within themselves so they feel the best they can. So this is my passion. I do that every day. And I
So
think,
tell me, because I read also that you're into the Blue Zone diet.
yes,
So I
yes.
have the book. Oh, I have my background on, but I haven't read it yet. I have it here. I'm in Florida. I have a winter home in Florida, and I bought this book last year to read. And I just came back yesterday, and here's the book still sitting. I didn't read it yet. But I do know a little something about that there's certain areas in the world that are the healthiest people in the world. Is that basically it?
That's
Yeah.
exactly right. There's many, many. And the funny thing about all of that is that those areas are untouched, not as much technologically advanced as we are. So they're not exposed to all the chemicals and the changes of the diet that, the foods that are available are not so processed. So in the end, when you talk about diet, really it's what is correct for your genetic makeup is what you need to eat. It's not the keto diet is the craze. Everybody should get on the keto diet. Or it's the Mediterranean. Everybody should be eating oil and, all this stuff. No, no. It depends on what your genetic makeup is. So the program that I follow, the blue zone concept I get the idea that you want to bring your biology into balance, into homeostasis. This is what we are trying to accomplish. And the factors that go into making that are different from one person to the next. They're not the same. So this is why we do personalized diets, which create the effect like it will create like as if you were in the blue zone. So this is what I'm doing. The actual diet that I follow and the program that I follow is called metabolic typing.
Okay.
And that is to type your metabolism to see what is the foods that would make the metabolism even improve than where it is now. So then you can get more energy out of what you're eating. What I tell people is this, you are eating so that you can get the energy,
Yes.
that you can survive and you can sustain. So if you are eating food and then you kind of fall asleep half hour later, that's not food. It's not food. It's just giving you a sugar coma or a food coma.
Yeah.
That's not really nutrition. So this is what I make my patients understand. So I think, and they follow very quickly. I have awesome patients. I love them.
That's great.
Yes, they are
So
very
do
good.
you get this determination from blood work? Do you take blood work and then determine how they should be eating based off of the blood work?
For the dietary, we have a questionnaire which is extremely detailed, which basically the concept is this, that you have something, there's two words. One is called genotype and the other is called phenotype. So you have acquired certain genes from your parents,
Yes.
and those genes have to express. So that phenotypic expression of the genes is so when we are giving you a questionnaire, they are noting down your phenotype. What is your phenotype? And then we connect the dots to your genotype. This is how it works. So we find out, okay, this is how you should be eating to get the maximum energy from your food. So the criteria to see if the food is correct for you is how do you feel 1 or 2 hours after you eat?
Okay.
So it's very simple. It's very practical. It's like nothing to weigh or how many pounds or how many kilos,
Yes.
whatever. It's not like how many calories are coming out. This is not the point.
Yeah. That's not sustainable long term anyway to
No,
have it
not
done
at
like
all.
that.
Not at all. You can do all sorts of things, and it's hard to continue anything like that. So we want to be very practical, and we want to be practical enough that we can get the result.
Wow.
Yeah.
Now, do you see patients virtually?
I
Like,
do.
so I'm thinking because if someone from New York hears this podcast and they want to get in touch with you, you're able to work with patients virtually. You send them for blood work and
I do, but it depends on what exactly is your problem,
yeah.
right? Like right recently I got a patient, I still have her. She's from New Orleans, Louisiana, and she heard about me and she actually came to LA and she stayed there. She stayed here for a few weeks and something that she was struggling with for like 20 years or longer.
Yeah.
And she was like, had no hope of ever recovering. And she's only like in her 40s, early 40s.
Oh,
And so I said, okay, well, and then she came in. We said, okay, great. And we started the treatments. And now she's gone home because she's doing great.
oh, excellent.
So you are welcome to come in. And then after that, once I get the first consult done, then, I mean, we can do virtual and then they should come in and then sort of we can do virtual. I do have patients all over the world.
Okay, that's what I wanted to know. Okay, cool. Yeah. Oh,
Yeah, I
what
have
else? Because
patients.
I took some notes. So let me see. What
Yeah.
else did I want to see? Talk about the blue zones, natural medication. So you do hormone replacement therapy, IV treatments, the nutritional coaching, which you just talked about. This sounds great. Do you have any final thoughts? What would be your recommendation for a woman who's in her 40s and is noticing that she's just not feeling like herself? She's tired. She's not able to sleep at night. She's already experiencing night sweats and hot flashes and weight gain. What is your recommendation for a woman to do at that point?
Yeah. For women who are experiencing any hormonal shifts that express in terms of night sweats or fatigue or even mood swings
Yeah.
or even difficulty sleeping or difficulty staying asleep. You wake up in the middle of the night a couple of times. Those are the early signs of hormonal imbalance. So I would say get a blood drawn. It's the simplest thing. Do the blood drawn and do that on a particular day, because if you're still menstruating and you have your cycles, then you want to get tested on the peak, at the peak of your hormones, which is between day 19 and day 21 of your cycle. So if you then get that blood tested and then you get it reviewed by a doctor who knows and who's familiar with the hormones, not necessarily an endocrinologist,
Uh-huh.
because they are trained into more like diabetes or thyroid issues.
Right.
They're not really trained into more like menopausal, because that menopause or perimenopause or premenopause is considered in the mainstream medicine not something that you would treat. That this is something, a phase in a woman's life they go through, and they just go through it. Like according to one of my patients, when she said, the doctor told her to just suck it up, that happens to the patient. So you would go and check this with your primary care is all I'm saying, because primary care doctor is going to dismiss it as anything that needs to be treated because you don't have a disease. So you would just go and see a functional medicine doctors that is actually familiar with bioidentical hormone replacement therapies and somebody who has experience. So then you can actually get started on the treatments. And the other thing about the treatment is some people have a concern that the hormones may cause cancer. This is one of the biggest concerns that people have. And the reason for that is the WHI trial that was done. I think the study was released in 2005, and it was basically increased risk for breast cancer, liver problems, and strokes, blood clots, all the bad things of the cancer. So the problem with that trial was that the hormones that were used were not natural hormones. They were hormones used that were synthetic hormones. And in fact, the word Premarin, they were given Premarin and Provera. So Premarin is the hormone that comes from the urine of pregnant mares.
Yeah.
And that's the hormone that the women were being given. So no wonder we had so many side effects. And the progesterone was not progesterone. It was called progesterone, but it's progestin, which is a modified version of progesterone. So it's synthetic to the body. And that's when we had so much trouble and the side effects. So I just make sure that, people who are looking for alternate solutions also are aware where the data is coming from and what is the purpose of it.
That's very good. That's very good advice. Absolutely. Absolutely. I was on bioidentical hormones for about 15 years, and it, it saved me. It really did. Even my sanity, not just physically, but emotionally as well, because it was rough. But so I appreciate the work that you're doing. And, I'm just hoping that we get more of this type of work, and we've go away from conventional medicine where take this pill and you'll be fine, because I just don't believe that that's the route to go. It really isn't. So I really appreciate the work that you're doing. And I'm so glad that you got in touch with me, and I love having you. Thank you, Dr. Anju. Thank you so much.
Thank you for having me, Susan.